On this edition of Veterans Health Watch, we'll learn what the VA Maryland healthcare system is doing to provide safe, quality, and compassionate healthcare to Maryland's veterans. We'll also hear from veterans about their personal experiences with the VA Maryland healthcare system. Welcome to Veterans Health Watch, a program sponsored by the VA Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin. There's been a great deal of national media coverage regarding allegations of veterans having long wait times to receive clinic appointments at some VA medical centers across the country. And joining us to talk about the VA Maryland healthcare system's commitment to veterans is Dr. Adam Robinson, Jr., the Chief of Staff for the VA Maryland healthcare system. Dr. Robinson, thank you so much for joining us today.
Thank you very much, Kenya.
Dr. Robinson, what is the VA Maryland healthcare system doing to maintain its commitment to Maryland's veterans?
The VA Maryland healthcare system is absolutely committed to patient and family-centered care for all of our veterans. We are committed to having compassionate, safe, quality care. We're committed to making sure that veterans get to see their physicians, their providers, when they need to see them. If it's emergently, of course, they can come in anytime, 24 hours a day. If it is elective, then we have a number of different methods for making sure that you can get the appointment that you need. We have a dedicated staff that is there to provide service to the veteran and to the veteran's family.
And I understand that the Department of Veterans Affairs Secretary has called for an access to care review at medical centers across the country. What is the purpose of this review and how will it impact Maryland's veterans?
The purpose of the review is to make sure that we don't lose our commitment and we don't lose sight of treating every veteran as an individual patient. We need to make sure that we focus on the needs of our veterans and their families, and that we also have a system that is responsive and reliable for them. We need to go back, we need to check exactly what we're doing on a daily basis in all of our clinics, our outpatient facilities, our outpatient clinics which are away from the Baltimore, and also we need to make sure that all of our outpatient clinics within Baltimore as well as our inpatient facilities are giving the care that our veterans need. I think that it's time to make sure that we don't lose focus of this one fact. Care in our system is dedicated to the individual patient and the family.
What mechanisms does the VA Maryland healthcare system have in place to ensure timely access to care for veterans?
I think the first thing we have in place, and the thing that is the most important, is a dedicated staff to ensure that we treat every veteran in an individual way. We try to make sure that their care is individualized for what they need to do. We also have a staff that understands what the system of operations is in our hospitals and our outpatient clinic. And so we're trying to make sure that we have appropriately scheduled clinic visits, that we ensure that the veterans know when those clinic visits are, that we follow up with them to make sure that they're making those visits, and if need be, we reschedule those visits. But we're there to make sure that they have adequate and very prompt access to care.
And we hear a lot about wait list. How does the VA Maryland healthcare system use its wait list to serve veterans?
A wait list, in my estimation, is another scheduling device. And that means that if there's an elective schedule of a patient, that is not an emergency, but an elective scheduling of a patient, there are mechanisms to ensure that we meet both the needs of the clinicians that may be there and also the needs of the patient. We review the wait list to make sure that we have access, that the veteran has access to care, but that we also know the timeliness of the care that is provided. For example, in some instances, a veteran for follow-up care needs to have a wait list, or they need to have an appointment that is dated farther out because they don't need to have a return visit for that care right away. So we have a mechanism in place to make sure that they can receive that care when they need it at the appropriate time.
And I know the VA Maryland healthcare system is a large system. You see hundreds and thousands of patients on a daily basis. How do you work with community providers to offer maybe the services that a veteran can't get within the healthcare system?
Well, if we cannot meet the needs of our veterans, particularly from an access point of view, and that could be from either primary care or from a specialty care perspective, we have a wonderful relationship with the University of Maryland. We have a wonderful relationship with providers throughout the city of Baltimore, but also throughout the state of Maryland, to ensure that we can get prompt care for our veterans throughout our medical institutions in the state of Maryland, so that we can know and dedicated to making sure that they receive the care that they need when they need it.
And you talked about patient-centered care. Everything revolves around providing for the need of the veteran. What about hearing back from those veterans to get their feedback on what they need? Do you have any mechanisms in place to allow for feedback from veterans, and what are those?
I think that there are a multitude of surveys that veterans can take, both outpatient and inpatient, but I would like to suggest that veterans try to do this. As our patients in the system of health in Maryland, I would advise them, and I would suggest to them that they do a few things. Number one, talk with your practitioner. Talk with the person, the provider that's caring for you, the nurse practitioner, the PA, the physician. Make sure that they understand what your needs are, and also tell them what needs are being met and what isn't being met. And the second thing is, if need be, you can certainly call my office as the Chief of Staff at the VA Maryland Healthcare System. I'm always open to calls and suggestions from any veteran regarding their care, regarding situations that they may encounter. And it doesn't have to be a complaint. I'm also open to having any sorts of laudatory comments. But what I want to do is mainly make sure that each veteran recognizes that our system is patient-centered. It's centered on the family. It's centered on that safe, compassionate, quality care element that each individual veteran who is our patient and we're privileged to care for is cared for appropriately.
Well said. Thank you, Dr. Robinson. And what about the commitment? We talked about the commitment to Maryland's veterans. Is there anything else you would like to add about what the VA Maryland healthcare system is doing in regards to that commitment to its veterans?
The VA is an extension of our military. And you may say, but it's not military. It isn't military, but it is extension of the service commitment to our men and women who have worn the cloth of the nation, who have retired or who have gone into a civilian capacity. It is our fervent desire and it is our dedicated belief that we should provide that service to them on a daily basis. As a 35-year veteran of the United States Navy, I'm dedicated to making sure that the men and women, those who've worn the cloth of the nation, in all the services, get the care that they need, and that is what VA care is all about. VA healthcare is about making sure that we continue the care and the commitment that our nation has said our veterans are due.
And as a veteran, you said you're a veteran yourself, what would you say to those veterans who aren't enrolled in the healthcare system? Maybe they are enrolled and they've seen the recent media coverage about the allegations of long wait times and they're unsure. What would you say to that veteran?
Well, I think that when you're looking at your healthcare needs, when you're looking at the fact that there is a wonderful, very exceptional healthcare system in the state of Maryland called the VA Maryland Healthcare System, when you look at the fact that this is the service and this is the care that you should get and that you have fought for your country to receive, when you look at what your service has meant to our nation, I think you should think in terms of making sure that we in the VA Maryland Healthcare System give you that same service back regarding your healthcare needs. I would say to everyone there that is eligible to please come. If you don't know whether you're eligible or not, please come to find that out. But if you're eligible, please sign up for that care with us. Give us an opportunity to show you that we are in fact patient and family centered and that we want to give you that safe, compassionate, and quality health care that you deserved. That is your right as a veteran in the United States of America.
Dr. Robinson, again, thank you so much for joining us. Thank you for sharing your expertise and for caring for our veterans throughout the state of Maryland.
Kenya, thank you so much for having me today.
We'll take a short break, but when we return, we'll learn more about the health care services and the benefits available for Maryland's veterans, so please stay tuned.
As a nurse, it's very important for me to see a friendly face when I come into the hospital.
I really didn't think I was qualified because I didn't have a service-connected disability.
Recognized for its state-of-the-art technology and quality patient care, the VA Maryland Healthcare System is a progressive organization that provides a full continuum of care to veterans. The VA Maryland Healthcare System is committed to serving the needs of veterans at 8 locations throughout the state.
At the VA Maryland Healthcare System, we're proud of our investment in technology because it's an investment in our veterans.
The categories of care have been opened up so that more veterans can qualify.
Tell a vet to call 1-800-463-6295 extension 7324 to inquire about enrolling in the VA Maryland Healthcare System.
When I came home from my military service, I knew that I needed help, and I went to the VA and they were there for me.
Welcome back to Veterans Health Watch. Joining us now to discuss the health care services available to Maryland's veterans is Dr. Sandra Marshall, the Deputy Chief of Staff at the Perry Point VA Medical Center. Dr. Marshall, thank you so much for joining us.
Thank you for having me.
Could you please provide an overview of the health care services available for veterans at the VA Maryland Healthcare System?
Right, well, the VA Maryland Healthcare System consists of 3 large facilities, one here in Baltimore City on Green Street, which is our hospital. We also have a campus at the Loch Raven and Alameda location within the city limits, and then we have a 3rd campus, the one that I'm located at Perry Point near the Delaware line. In addition to that, we have 6 community-based clinics in which we provide a variety of services for our veterans. We provide primary care and mental health care at all of our locations. We also have comprehensive women's health care that we provide to our female veterans so that they can see one provider and receive that care that they normally would in primary care, as well as their gender-specific needs. We provide a variety of medical and surgical subspecialty cares, and we also have care that we provide through a mechanism called telemedicine.
With such a large system, how does a veteran access the services once he or she is enrolled?
Well, we are dedicated to a patient-centered approach to care. So along those lines, we enroll each of our veterans with a PACT team. So PACT is our patient-aligned care teams, and that means that each of our veterans, when they enroll, are assigned a provider, a registered nurse, a health tech, and a clerical support staff member to help coordinate and take care of the veteran and see that their needs are met.
In our previous segment, we talked about the wait time issues that we've heard about at some of the medical centers across the country. Talk to us about how a veteran can communicate with a provider or access a provider to receive health care services.
Well, we have some wonderful systems in place to help veterans communicate with their PACT teams, so that one of the methods that the veterans can use is our secure messaging system. So secure messaging is available to veterans who sign up for My Healthy Vet. They go in and the system allows them to talk to their primary care provider team so that if they have a medical need, they can let the provider know. I personally had one provider who was working towards better control of his diabetes, and we were able to do treatment plans and obtain consultation through the secure messaging system and really meet this veteran's needs in the way that he needed it. He worked. He wanted to reduce the number of times he came to the medical center, and we were able to communicate via that method. We also have telemedicine so that our veterans who are at our community-based clinics, if they need specialty care with some of our providers who are located in Baltimore, can have that care and that access through this mechanism and actually have face-to-face visits with their care provider remotely. We also have home telehealth, and I have had a number of patients enrolled in that service where those veterans who have heart failure, diabetes, hypertension, may want to lose some weight and get into our exercise program can access that service from their own home. It's been wonderful.
What about the veteran who needs immediate care?
Right, well, we do have a variety of ways for our veterans who need immediate care to access care through us. We do have an emergency room located in Baltimore. It's open 24/7, 365 days a year, fully staffed by emergency room physicians to handle any care needs that present to our facility. We also have a 24/7 telephone care line, so veterans can call at any time and speak to a registered nurse and be directed to the appropriate level of care that they need. We do have an urgent care clinic at Perry Point for those non-emergent problems, but things that need to be seen that day, so veterans can come there weekdays and be evaluated by our providers. The primary care providers do have acute visits each day, so that if veterans call the telephone care line, they can speak to the nurse and see if their provider has an acute care slot available for them to be seen and evaluated. And then we also have mental health walk-in. So those veterans who might wish to be seen for mental health concerns, they actually have access on a walk-in basis to do so.
It is good to hear that our veterans have so many options to receive the health care services. With more than 55,000 veterans enrolled in VA healthcare, well, VA Maryland healthcare system, what initiatives do you have in place to ensure patient safety?
Oh, so patient safety is a high priority for us. So we have a number of mechanisms, one of which is a safety hotline. So staff can call in, patients can call into the safety hotline and let us know if there's a concern that they've identified. We also have a communications mechanism with our director in the hospital on our website. So if an employee sees something they're concerned about, they want to bring it to the director's attention, the executive staff receive these messages. It can be done anonymously if the employee chooses to do so, and then we can address those issues when they're brought to our attention. We also have a program that we've initiated called See Something, Say Something, where we try to make sure that everyone knows that if they have noticed something of concern, if something is come to their attention that they think needs to be addressed, they just need to say something. They can say something to their supervisor. Dr. Robinson's office is open. Certainly the director of the medical facility is more than willing to hear concerns and is very dedicated to making sure that safety is a priority for us.
I know that customer service is also a priority for the VA, and the VA nationally was recently recognized for having veterans report a high satisfaction when it comes to their quality of care received at the VA healthcare system. What is the VA Maryland healthcare system doing to address customer service? What are some of the initiatives you have?
Well, we have dedicated this year to be our year of exceptional customer service. So it's really in the forefront of all employees' minds that this is a priority for us, and we want to make sure that we reach out to our veterans and address the needs that they have in a way that they would like. So to that end, we've started gourmet rooming in service, so veterans can select their meals in their rooms. We've started the Get Well Network, which allows the veteran to receive education and provide feedback to us right on their television screen in their room when they're an inpatient. We also have our customer relations staff go out into our clinics and the inpatient areas and do real-time surveys with veterans to get feedback from them. We hold open forums with the employees to hear how we're doing. Many of our employees are veterans as well and can give feedback when the director and our regional area director come and hold these forums for us so that we can provide exceptional customer service. Veterans receive surveys in the mail that they can give us feedback to let us know how we're doing. These things are taken very seriously, and we've made a number of changes based on the feedback that we get from veterans.
Dr. Marshall, I know that you have been a provider with the VA Maryland healthcare system for quite a while. So as a longtime healthcare provider, what would you say to a veteran who is maybe unsure about using VA healthcare services?
I would reassure them that we are here. We have dedicated staff that wish to provide quality, safe, compassionate care to all of our veterans. And I know we're not perfect, and I know that there are times when veterans need to speak to us and voice their concerns, and I want them to know that we're here to hear those concerns, that we're here to address those concerns, that we want to make sure that the care that we provide meets their needs in a way that they need them.
Dr. Marshall, thank you. Thank you again for joining us and for sharing your expertise at the VA Maryland healthcare system.
Thank you for having me.
We're going to take a short break, but when we return, we'll hear from veterans and how the VA Maryland healthcare system has addressed their needs at the Baltimore VA Medical Center. So please stay tuned.
The VA Maryland healthcare system is a great system.
It's not your grandfather's VA.
We are a progressive and dynamic healthcare system.
And it's our mission to provide the highest quality healthcare to our veteran heroes.
Great programs, great technology, great staff.
And it's just touching to see how everybody just come together as one.
We do what we can to see that they get the best service.
It's a family. Nobody takes better care of you than family.
Welcome back to Veterans Health Watch. My name's Chris Buser, and I'm here at the Baltimore VA Medical Center talking with a few veterans today about their health care experiences with the VA. And joining me now is Ms. Erica Gillespie, a U.S. Army veteran. Erica, thank you for joining me today.
Thank you for having me, Chris.
Erica, could you tell our viewing audience a little bit about your Army experience?
Well, I went in the Army when I was 17 years old, had to get my parents' permission, and in 1990 I went to Desert Storm. I got out in 92, but I missed the Army so much that I went back in 90, I believe it was 96. I went back in and served until it was time to go to Iraq. I went to Iraq in 2004, got injured in Iraq, and ended up at Walter Reed for approximately 2.5 years and ended up here. So that kind of ended my Army career.
Well, that's an incredible story, having been in the Army for two different periods. Can you tell us a little bit about how your journey led you to the VA Maryland healthcare system?
Well, I came here because after being at Walter Reed for so long, I still needed extensive health care. So by the time I got out of the Army and was retired, when I came to the VA, everyone here was already waiting for me at the Operation Iraqi Freedom office. They had been waiting for approximately 2 years. So when I got to the office, they already knew my name. They already had my appointment scheduled, and I was just ready to get acclimated into the medical system here. So it was great.
Erica, it sounds like the VA Maryland healthcare system knew to expect you. How did they reach out to you?
Well, after I got to the OIF office and they had the appointment scheduled, they also put me in this clinic called the Polytrauma Clinic. So they met all of my needs at one time. Instead of me having to schedule an appointment at this clinic and then at another clinic and then at another clinic, the Polytrauma Clinic allowed me to have all of my appointments or all of my needs addressed all under one clinic. Polytrauma is for veterans or for soldiers or whomever that have experienced multiple traumas while they were in combat or serving in the military. So as for me, I had a traumatic brain injury, post-traumatic stress disorder, and then orthopedic issues as well. So in that clinic, they covered all of that.
Well, it sounds like that was a very positive experience for you. What would you share with other veterans who are thinking about seeking their care for the VA Maryland healthcare system?
I would say absolutely take advantage of what is in place for you. Don't go to a civilian doctor that is not accustomed to dealing with soldiers' needs. The VA is here and they're for soldiers. They're here for us. And if it wasn't for the VA, I wouldn't have even known that I was being treated for a traumatic brain injury. So I would say please take advantage of what's in place for you.
Well, Erica, thank you so much for sharing your wonderful story with us today. We really do appreciate that.
Thanks.
Joining me now is the Reverend Richard Mosley Sr. Reverend Mosley, thank you so much for joining me today.
You're welcome.
Now, Reverend Mosley, oh, you're very welcome. Reverend Mosley, I know that many of our audience members might recognize you from some of our previous episodes of Veterans Health Watch, and in the past you've been on and talked about your military experience and how you've come to the VA for treatment for post-traumatic stress disorder and also personal stress. Can you tell our audience why you continue to come to the VA for your care?
Well, one of the things I found is that the staff here is responsive, not just in the mental health field, but also throughout the medical area. My primary care doctor, my cardiologist, neurologist, but particularly mental health, which is my major issue right now. And they've been responsive since I've come back here in 2009. I started initially in 1973, but it's just been an overall positive experience for me. You know, the people, the therapist that sees me, he is one who recognizes my spirituality and understands how much that plays a role in my recovery.
And how has the VA continued to treat some of your other physical issues?
Well, I get treated for my diabetes. I have diabetes, I have ischemic heart disease, and my medications, and a few surgeries I've had, and a couple of outside surgeries, but the VA has been there to pay for it and to make sure that I've gotten the follow-up care that I need to get.
Well, that's great. Reverend Mosley, I understand that you now volunteer in our peer support trauma program. Can you tell us, our audience, a little bit about that program?
Yeah, that's an awesome program, Peer Support Specialist, because I've often believed that folks who know what you're going through can better respond and better relate to what you're going through. And having suffered from PTSD and still suffering from PTSD, it's a reward to go in and be able to share my experience with some of the veterans, not necessarily my combat experiences, but the experience of overcoming PTSD, or at least arresting it to the point that it's tolerable and I can manage it.
Yeah. Well, it sounds like your participation benefits not only the veterans that you work with, but also you.
Oh, absolutely, absolutely. I mean, it's a constant reminder of what you've been through. And also it's, you know, I feel like as veterans, if we have the opportunity to give back to our fellow veterans, then we need to. You know, of being a Vietnam vet, and I don't have to tell a lot of the audience, but some audience may not know, the welcome that we received was not a real welcome. And I think it's imperative for veterans to make sure that other veterans are welcomed home and given the care and the attention and the response that they need.
Right. And for our veterans who are out there watching, or even for the family members of veterans, what would you like them to know about the VA and how it can help their needs?
I've been coming here for more than 41 years. When the hospital was on Loch Raven and now downtown here. And I've not had an instance where my treatment was subpar. I've been able to count on them. I still come because I know this is the only place that I'm going to get the quality care that I need. This is a place that I trust with all my medical issues and my mental health issues. Family, please get involved with your veterans, particularly with post-traumatic stress disorder. It's imperative that families get involved and not there was a point when my family thought that it was just something I was making up because they didn't understand it. And I think that happens to a lot of families. They think that the veterans making things up because they don't understand what you've been through. Veterans, please come in. You know, it's we get caught in that stoicism where we think we're strong and we don't need the help, but we do. And it's imperative that we come in and get that help.
Reverend Mosley, thank you so much for joining us today. I really think that your candid responses will resonate with our audience. So thank you so much for joining us.
And thank you for having me. I mean, it's really a pleasure to be able to share with other veterans. I really appreciate you all, the outreach that you're doing. This is a form of outreach. So thank you.
Well, thank you. And now let's kick it back to the studio.
Thanks, Chris. Well, that wraps up this edition of Veterans Health Watch. If you have questions about today's show, or if you'd like to make suggestions about future topics, please call us at 1-800-463-6295, extension 7101. Or you can visit us on our website at maryland.va.gov. You can also follow us on Facebook and on Twitter. And remember, if you are a veteran, or if you know a veteran who is not receiving VA healthcare services, please call us at 1-800-463-6295, extension 7324. Visit us on our website or come to any of our VA medical centers or outpatient clinics. We'd love to serve you. Please join us next time.
A lot of women veterans don't realize that the VA is here to take care of them. They served and they deserve the best health care that there is. The Women Veterans Program has been redesigned to meet the needs of the women veterans.
Female veterans receive just as good a care as men because they're focused more on us now.
We want them to come here, we want them to feel welcomed, and we want them to know that we are capable and willing to take care of them.